Kasi tanpan ka na yalan natin. Yan ako.
Okay, so again, LEOPOLD's maneuver is usually performed number 1 dito ating mga communities. Kaduha, sometimes it is also done dito aton hospitals before the baby or before delivery. So labor watch naton nag-LEOPOLD's maneuver niya. Because diba, as nakita LEOPOLD's maneuver, one of the purposes is to check for the fetal bag. Okay, so pag maroon yung fetal bag, dito natin mapupuntangan aton equipment to check for the heartbeat. Okay, so but usually it is done dito aton mga communities. Okay, so again, pag ato natin dito, so it's either you go to the patient's house, okay, when you do your community visit, or another mga nanay makatulid to ha iyo sentro, okay, to do the LEOPOLD's maneuver. Okay. So again, when you enter the patient's room, okay, you introduce yourself. Ma'am, okay ako lo, ako po ni Paul, I am your nurse. Okay, so aani kita yan na para himo nato ang atong LEOPOLD's maneuver. Okay. So atong LEOPOLD's maneuver, kasasabtan nato kung anong position ng atong baby dito kasulod ng yan. Okay, so you give information about what you're going to do. So ito natin course, ito natin LEOPOLD's maneuver, makaputwa ko haimo. Ikakaptun ko kung imo tiyan, okay lang ba? Okay, you get permission that you will be touching the patient. Especially if you are a male nurse and you are touching your patient. Okay? You always have to get the permission. Okay? Ako rin na bang kita kasuhan in sexual harassment or assault. Okay? So you always have to get permission. Okay? Then after that, inform them what we're going to do, what the purpose is. Okay, so you get the consent. Okay, so you do this one to get number 1 another permission. Ikaduha, if the patient knows what we're going to be doing, you are getting their full cooperation. Okay, ready man haraton ano itong imong. Okay, so after that, after you have you have explained whatever it is that you will do, then you do your hand washing. When you do your hand washing, preferably you do it with a warm water. Kaya kailangan warm water.
Para matanggal talaga.
Kaya kailangan warm? Para diri? Okay, so that when you touch the patient, ang atong pasyente, diri magiging uncomfortable. Okay, so kung waray warm water, ano man? Sige na, paglasadaan na yung so okay, lagi sa baray. Kung hindi available na warm, you do warm water. But if, let's say for example, ikaw nagkakapilito mo itong balay ng nanay, kung waray, you can use your hand drops or you can use your alcohol. Okay? But preferably, if you do it, you wash your hands with soap and water and with warm water. Okay? So after that, nagyakan ka na, what's this? Nagyakan ka na yung purpose, you did your hand hygiene. Now, you ask the patient to, what's an important thing happen para nahimo ni patient before we start the procedure? Okay, good. Kaya naman kailangan mag-empty itong bladder ni nanay. Para di rin paano ma-interrupt itong Okay, so number 1, for comfort mo patient. Okay, di ba? Let's say for example, magmata kita itong madaling araw, di ba? Let's say 2 o'clock, 3 o'clock. Tapos masakitin do, puno na natin pagtog, maiihi. Pero kay ginuubya ka, kay hagkot, namuran na gawas, di ba? Rumpot, di ba? Pero pag makaptan nimo, pag sulod nimo, nasabudan nimo tiyan, di ba? All. That's the same thing. Okay? So, hinanay, number 1, burod na nga niya, may dana baby hasulod nga, nailipit na niya bladder, tapos buti ay na ito nga kapot, ito na no, magiging uncomfortable na. Especially kung full bladder ni nanay. What else? Ano pa itong purpose? Kaya kailangan maaram kita? Kaya kailangan ipahigin ni nanay? Kaya ano to? Kaya ano? Okay? Because again, another thing why we need to ask the mother to empty their bladder, because we are going to be palpating for the patient's abdomen, okay, the uterus. If the patient's bladder is full, you might mistake it for the fetus. Okay, wala nay, mali ng ulo ni baby. Ngayon, pantong na lang yan. Okay? Wala pa nga, hindi pa nga na-disposition. Wala na yung ulo na. Kasi balik na kita, nay. Diba? Ang ito. So, number 1, comfort. And number 2, we have to ask the patient to empty the bladder so that we will not mistake the full bladder as any part of the fetus. Okay? So, again, number 1, we explain, we grade, explain the procedure, get consent. Ikaduha, we do the hand washing. Ikatulo, we ask the mother to void. Ikaupat, we ask the mother to lie down and and assume the proper position. Ano ang proper position naton? Ang aton pag-LEOPOLD maneuver. Supine position na ba? Okay, so it is your dorsal recumbent position. Ano is dorsal recumbent position? When say dorsal recumbent, it is a supine position with the knees flexed. Okay? Kaya kailangan naka-flex itong knees ni nanay. Good. Para ma-relax ang abdominal muscles ni nanay. Okay, di ba? For you ladies, di ba, dahil pag may dyspnea kita or isang doon na talaga may masakit atong tiyan, we usually do a fetal position, di ba? Di ba nasuot kita ito? Because when flexing the knees or your legs, ang ating abdominal muscles mas nagiging relaxed. Once the abdominal muscles are relaxed, it is going to be easier for us to palpate the fetus inside. Okay? So again, dorsal recumbent position, supine position with the knees flexed. Ano pa? May napakita, other than the knees being flexed, what else do we need to do? Okay? So, anato sa pillow. Okay, so you have one pillow, tiga ulo. Ikaduha nga pillow, adin dito. Bubos lang. Okay? So, adi ito iya, so dili kailangan naka-ikaw ito, puputangan mo lang dito. So, flex na gihapon ito iya. Okay? So, what else? Aside from the pillow, on the head, on the knees, ano pa? This is not the proper position pa. Gano? Left seam, very left. So, ato kita right side. Okay, then one. Ato, right. So, you are going to put left foot na. Tama lang. You're going to, the mother is going to be facing the left side. Kaya because you need to put a pillow, another pillow on the lower side of the mother, lower back. Okay, Nay, ma, kita? Okay. Ayaw nagtiya pa, So what is the purpose of putting a pillow on the right lower side of the mother? Ano ang purpose nato? Okay. Okay, good. Pwede. Pero di rin patumpak. Ano man, tumpak. Who else has another idea? Okay. What are we preventing here? We are preventing
Para di ka na mag-impact with mga organ.
hypotension. We are preventing supine hypotension. Okay. Kaya ano nagkakaadang supine hypotension? Kung nahigdahin nanay. Kaya naman kung kita nahigda, wala kita supine hypotension. Kaya naman hinanay, mida supine hypotension. Kaya mida, may baby and uterus. So ano man? Siyempre, kikita lang yung nanay. Anong different pregnant woman yan? Yung pregnant. Kay? Okay, so ano man ang purpose na itong pag side-lying niya?
Para di rin ma-compress or ma-datugan ang vena-cava.
Okay, so we are releasing the inferior vena cava. Okay, so anong gamit na inferior vena cava?
It supplies blood to the heart.
Supplies blood to the heart. Ano ba?
When passage.
It? Anong gamit ni inferior vena cava?
Concert.
Oh.
Ako ang lahat.
Anatomy first year pa to. Hello? Ako may hanap dulo, nakainom pa ako. Balit, kaya anong gamit ni inferior vena cava? The inferior vena cava delivers deoxygenated blood from the extremities back to the heart. Okay. So yan kung may pregnant woman na higda, because of the growing fetus, the fetus can block the inferior vena cava. So kung naka-block ang inferior vena cava, ano man matatabo? Okay, so the delivery of the deoxygenated blood is not sufficient to go back to the heart. So, the heart, ano man, waray blood nga napapam. So, waray nagkakadayahin hypotension. So, anong gamit natin pag-tilt? Because when we tilt the mother to the right, inferior vena cava kasi aditi right side. Okay. So pag i-tilt natin hinanay, anatong baby, anatong fetus rather, it will shift to the left, releasing the pressure on the inferior vena cava. Once pressure is released on the inferior vena cava, blood flow can flow easily back to the heart. That would preventing supine hypotension. Yes? So, how the purpose? Okay? So dorsal recumbent, knees flex with pillow on the right lower side of the mother. Okay? So again, ano ito natin first step? Choose yourself and get a consent. Ikaduha, hand washing. Ikatulong, ask the mother to void. Ikaupat, okay, so proper positioning, dorsal recumbent, knees flex, pillow on the right lower side. Okay, next. Ano sunod natin? Okay, so before we start, you always remember, diba, to maintain privacy. Okay? Siyempre, we are going to be exposing parts of the mother. Okay, so dapat, kung may drapes ka din at yung clinic, you do that. Kung may dali ito kwarto, itong balay, ito yung bakatuan, it's much better kung dito natin ito. Okay, dito natin i-perform natin LEOPOLD's maneuver. Then, of course, you provide drape gihapon, like common. Okay? And always only expose the part that you need to expose. Dili kay pag sila hanay, sige start sa kita. Sige na, igbawa ako. Ayaw. Kung ano na kailangan, amo na natin i-expose. Okay? Pangin pa kumato dito, sige, abrinin mo nga tanan, sumunod dito asawa, okay, magantay ka. Okay, so only expose the part that needs to be exposed. Okay, so, yun mo. So only expose the body part that needs to be exposed. Okay? Okay, so ready na kita. The patient is now prepared. We are now ready to do the LEOPOLD's maneuver. Okay, so number 1 is our fundal grip. So please note that during the 4 steps of LEOPOLD's maneuver, for the first 3 steps, you are going to be facing the patient. Pag-abot natin itong 4th maneuver, ato nang kita mag-face itong tail. Another also is, during the course of the LEOPOLD's maneuver, pag makapa nimo, when you do the first maneuver, tapos you have determined that the patient is on a bridge position, then you don't have to, you don't have to proceed to the fourth maneuver. Okay? So again, first 3 maneuvers, you are facing the client. On the 4th maneuver, you are going to be facing the feet of the client. Kaduha, once you have determined that the patient is on a bridge, that the fetus is in a bridge position, you don't have to move forward to the 4th position or the 4th maneuver because diri na kailangan. We will discuss that one later on. Okay? So again, first maneuver, first, second, and third, you are facing the client. So you have your fundal grip. The fundal grip determines what?
Presentation.
Is a fetal presentation. So, what do we do? So, anaton pad, pili kita maghimo-himo baga triangle. Okay? Tapos, you are going to feel for the fundus of the patient. So, what is the fundus? Ano yung fundus?
Upper part.
Okay, so it is the topmost part of the uterus of the mother. So, maghimo kang triangle and you are going to feel for the fundus. Okay, so when you do palpation, imuhiyahin, you are going to push your pads. Okay, use the pads of your fingers and push it downward. Pag push niyo downward, you are going to feel for whatever it is that is in the fundus of the mother. Okay, so if you are going to feel a soft, rounded shape, that would mean that is you are feeling the what part? You are feeling for the head. So ano man na presentation ito natin baby? That is the bridge presentation because the fetal head is in the fundus. So most probably ang leading ito lubos, ito niya may bubot is the bubot dito ito uterus, dito lubos is the fetal buttocks. So let's say for example you do the first position or the first maneuver, tapos ang iyong pag-ano nimo is soft and not well defined. That means that is
The head.
you are palpating the
Head.
buttocks. Okay, soft man iya.
Soft.
Diba? So feel na rin yung bubot kung hindi rin soft. Okay? So it is soft and not well defined. So that means that you are palpating the buttocks of the client, of the fetus. So that means that the fetus is in which presentation? Buttocks na hindi. So ano na?
Cephalic. Cephalic.
Head na. So that is in a cephalic position. Okay, again, make a triangle. Okay? Tapos siniputang niyo, ang iyong pads at itong fundus itong nanay. Then you are going to press downward. Palpate. Okay? So ganito. You are going to palpate. So again, if it is hard and defined, that is the head of the baby or of the fetus. So the fetus is in a bridge presentation. Pero pag feel mo nga soft and not defined, that means that it is, you are feeling the buttocks. So that is, the fetus is in a cephalic presentation. Kuha, kung ano yung fundal grip. Question. Alright? Yes. Okay, we will talk about that later on. Okay. Now, di ba nagsalita kita kanina nga start kita on 6 months. Okay? So when you do your fundal grip, okay, so you are checking for the presentation. The baby will assume its final presentation on its 8th month. Okay? 8 months. Okay? Anong meaning ito? So meaning from 6 months to 8 months, kung naka-bridge siya, pwede pa ito bumalikan. Okay? But once we reach the 8 months, the baby is now on its final presentation. Kung bridge ito, bridge na talaga ito niya nga makawas. Kaya ano? Because the baby is already too big for it to rotate. I-remember dito sulod, kung buti ay pa kasi itong baby, naglilibot-libot na niya dito. Okay? Dapat ba doon ito niya space to roam around. Okay? So dito yan nakaturo ko dito sa naka-space or sa position. But once the baby reaches 8 months already, the baby is already big enough na di rin nahiya na i-go para mag-move around. Okay? Kuha? Okay. Next is your umbilical grip. Ano ang gamit ng umbilical grip? So it determines the fetal pack. So how do we do that umbilical grip? So umbilical grip, you are going to put one hand on one side of the of the uterus. Ano sa hand tiwa? Ay didiling amat makapak. Okay, so one hand is pushing, the other one is palpating. So from the top, we are going to palpate downward. Same gap on other side. You're going to push the other side and you're going to palpate downward. Okay, kuha. Kuha. So you are also checking. So if you are going to be palpating a smooth and well-defined surface, you are palpating what? The fetal back. Hindi ba smooth man? Okay, or as hard. But if it is not well-defined, that means it is your anterior part of the fetus or the front. Kaya naman niya diri well-defined. Eh, syempre, nasugat. So, makapagkadi, mas mahigbaw, mas maubos, mas mahigbaw, di ba? Sugat. So, diri mo na determine well-defined. It's not well-defined. Okay? So, again, one will push, the other one will palpate. Kaya kailangan i-push ang anong anti-yan? Ha? Diri magluya-luya i-baby. Kaya let's say for example, sugarang nimo. So dapat i-push nimo ni baby. Okay? So again, you have your fundal grip, you have your umbilical grip. Kuha? Kuha? Okay, question so far? Alright? Okay, so pag na-determine na tatlo ang fetal back, so ato na natin ibubutangan aton stethoscope. Okay, so that is where we are going to be checking for the fetal heart tone. Okay, so for the fetal heart tone, binagita mga equipments na ginagamit. So usually what we usually use is the stethoscope. But the stethoscope is di rin niya pwede gamiton duration talaga hiton aton pregnancy. Okay, sometimes especially pag early stage of aton pregnancy, we still cannot use the the stethoscope. Okay? Because sometimes because na kailangan 6 months na kumaday ito na itong baby atong clinic to do the LEOPOLD's maneuver, that doesn't mean that it's the only time na nakita kita itong fetal heart tone. Okay? Bisan less than 6 months, we can also check the fetal heart tone. Okay? So, pero di rin natin magagamit ito natin ordinary stethoscope. We have other equipments. So, let's say for example, the patient is only 2 months to 3 months, you use your Doppler ultrasound for that one. Okay? 2 to 3 months. Pag 3 to 4 months to what? You have your fetoscope. Okay, so ano fetoscope? Fetoscope, bagalagapitiyan, bagalatiyahin stethoscope. But instead of this one, the diaphragm, minatiya bagatin apak, o nga ni, nabagat nasa ganito, or yun ang markaturo, di ba nasa ganito? Tapos ito nga edge, ano yung ganito, tiyan. Okay, so I'm gonna check. You can search it in Google. Okay, so again, 2 to 3 months, use your Doppler ultrasound. Kaduha, that is your 3 to 4 months. You can use your fetoscope. Yeah. Then, pag 5 months na onwards, that's the only time that you can use your stethoscope. Okay? Ito ha, fetal heart tone. Normal fetal heart rate is for the fetal heart tone, we will the 120 to 160, but for these purposes, we'll use 120 to 140. Okay? In the books, 120 to 160, but for us to have a uniform range, we'll use 120 to 140. Okay? So, okay, remember, acudal grip, umbilical grip, pollex grip.
120.
Ano natin, what did we say? What are we determining during the pollex grip? We are determining if the fetus is already engaged. So how do we determine the engagement of the fetus? So with the use of your middle finger and your index finger and the thumb, you're going to put this one in the kaubos. Dito kita fundus, patadi kita lower part. So what you do is, you are going to press your fingers together. Okay? Ibubutang nimo together. If let's say for example, your fingers are still able to come together, so na ano pa nimo together natin fingers, that means that the fetus is still not yet engaged. Kaya ano? Because if this is the fetal head or the fetal buttocks, pag igano nimo, if you're going to press it together, floating pa hiya. Okay? Na ano pa nimo? Napupush pa nimo. So that means dili pa engaged a fetus. But let's say for example, engaged na yung fetus, what will happen? Dili mo na ma-put together. Kaya ano? Because naka-fix naman niya pelvic inlet. So if you're going to push your fingers together, dili na pwede. Okay? So yun. So one thing hapon, pag i-press mo, it's engaged na hiya, paano nimo masasabtan kung ulo it niya or tiyan gihapon or buttocks gihapon. So once you know that your fingers are not able to go together, if you are going to move, tapos pag move nimo, movable iya, pero ang tiyan di rin na move, that means that you are touching the head of the baby. Kaya ano, kaya pwede mo naman sugod-sugod mo na tiyan dito sulod. So yung head, di rin na, ang liog, awan niya bali, di rin na move. But if it is the buttocks, ang buttocks, ang bubutan nito na pag i-move nimo, syempre, natanan niya ma-move. So makita kang tiyan, masugod niya po niya. Kuha? Okay. So, ano na kita pollex. So you already know the funda, the umbilical, and the pollex. Questions, Santulo? So again, remember, when you do gentle pressure, ay dito ay pagdigil ng conjunctum nimo. Gentle pressure. Okay? Questions, 1 to 3, maneuvers? Wala. Okay, so we now move on to the fourth maneuver, which is your pelvic grip. Paano natin yung kanina? Okay. So, fourth maneuver, we are now going to be facing the patient's feet. So again, ano pa natin sa provision gihapon to do the fourth maneuver? Kailangan dire bridge presentation. Okay. So ano natin purpose na natin pelvic grip? What do we determine? Determine the fetal attitude or deflection. Siyempre, we are determining the flexion of the patient's head. Kung bubot din magagamit. Diba? Kaya di naman na-flex itong bubot. Diba? So, if the patient's presentation is bridged, we don't need to proceed to the fourth maneuver. Okay? So, yun. So, how do we do our fourth maneuver? So, you are going to press, you are going to put your two hands diniton, up mga 2 inches above diniton iya tiil. Okay? So, ganito. Then, you are going to press forward. Okay? Press nimo forward. Ikan to hiton, middle part. Okay? Ito naton uterus. Pag-press nimo together, tapos, nafe-feel nimo nga on both surfaces is smooth and there are no obstruction, then the baby's head is properly flexed. Okay? Kaya ano? Okay, let's say, iti mo man ito naging, pag naka-flex ka si baby, iti mo na kakapaan, iya, ulo. So, ini man. So, one is here, kay, ano kasi, itong ulo kasi itong baby, iti itong position, naka-side. So, if the baby is flex, nasugad ito, so naka-side, amoy iti mo na-feel. So, it is smooth. Okay? Waray obstruction. Okay? So, that means the baby's head is fully flexed. But let's say, for example, pag-move ni mo, pag-check ni mo ang fourth maneuver, one of the side, there is obstruction. Okay? Because another side smooth. That means that the patient's head is slightly flexed upward. So, it is in a brow position. Kung baga nahangan lahiya. Kaya one side, you are palpating the occipital part. Ano sa nga side? Nawong. Hindi may tirong. So, nahangan hiya. So, that is your brow presentation. Now, pag igsugad ni mo liwat, nga both sides liwat na yan may the obstruction, that means that the patient is that the fetus is in a military presentation or your mental presentation. Ano meaning ito? The fetus head is hyperflexed. Nahangan-hangaran na talaga. Nga hindi mo na nakakapa, ininda din nga part ng itong shin na. Okay? So, ang ito, may obstruction na din, may obstruction pa din. Okay? So, those, especially the mental or the military position or presentation, it is difficult na para deliver. Okay? Questions? So, that is your pelvic grid. Okay? Degree of flexion. Okay? Ano to natin, what's this? Ano ito natin ideal na attitude? Ito natin Okay? It is, the baby's head is properly flexed. Okay, so pag properly flexed ang baby, ano na nga presenting part?
Occipital.
Okay, so the sub-occipital phlegmatic, which is the smallest diameter of the fetal skull or the fetal head, which is about what? 8.5 centimeters. Okay? Questions? Okay? So after that, nakuman na natin, again, Nay, salamat po, thank you very much na natin pag-cooperate. Sa pukit na natin Okay? So you are going to relay your findings ito natin pasyente. So for Nay, what's this, natin procedure, kita natin na, natin baby, nauna pa man na natin ulo niya, antipagawa. So, ideal man niya for delivery din. Okay, so, but let's say for example, naka-bridge position here, again, 7 months ang baby, so maano natin niya yung itong nanay? Okay, so, nay, currently yan anak kong pagkapa, ang bubot po una dito aton, tipagawas. Okay? But because 7 months pa lang kita, pili pa bumalikan ang atong baby, ang atong fetus, balik na lang kita sunod ng bulan para i-check natin otro. Hopefully, by that time, bumalikan na iya. So again, 8 months ang pa natin pag final presentation ng baby. So pag final presentation ng bridge lagi hapon, then we ask the mother, we give them options. Anay, dili ideal po ang atong pagbuburod din aton kay naunahan aton ubod. Okay? Mas mobile po kung dito kita may kita access sa hospital para ito natin pagpanak. Okay? Kung magkukurin kita pagpanak, kung hindi kita sa sentro. Okay, you give them options. You tell them kung ano ito mga pwede ng mga kapatid. Okay? Sige, okay na. Thank you. Okay? Questions?
Na tayo na.
Ay, hindi rin mga yan! Balik. Sorry. Okay, so, di ba, we do the, when we do the LEOPOLD maneuver, so when we check for the fetal heart tone, Okay? So you can do it either after the second maneuver or you can finish the 4 maneuvers then do the fetal heart tone. Okay, so paano natin, how do we check for the fetal heart tone? So, again, we determine kung hain na natin fetal back. Okay? So fetal back, so pag push, tapos palpate. Okay, then push, then palpate. Okay, push, then palpate. So let's say for example, pag palpate ko this is the hard part. This is smooth and hard. So hain na ako akong fetal back. Left or right? Aniha? Right. Okay? Remember, when you are when you are referring to left or right, you do it on the perspective of the patient. Diri mo. Okay. So when I say the right side, it is not going to be my right, it is the right side of the patient. Okay? So right side is hard. So ato dito akon fetal hard. O akon fetal back. So if when you check for the fetal heart tone, it is not actually only the second maneuver that we need to determine. Also the first maneuver. Kaya why do you think? Why do you think we need to know kung hangin ng ulo gihapon atong pasyente? Kay? Ano man? Kung wala pa rin likod. Okay, very good. Okay? So, kaya natin kailangan masaktan? Because, once we know where the fetal head is, dito gyapon natin ibubutang na parte. Kaya let's say for example, fetal back. Tapos, bridge position. So, ang ulo hain. Ano ikaw, ano boss? So when you are going to check for the fetal heart tone, so you are going to push this one, fetal back, so adi ako ni So ulo man niya ni so adi ako upper part. Dili ako makarinig, kaya adi ko ulo, so batak sa na akong gawin kakapa. So syempre, di ba, itong heart, adi man may ulo. So ang kailangan get natin ng first maneuver. So let's say for example, right side is hard, tapos the patient is in a bridge position, so head is here. Adi ako ni Dima. Check. So again, press, one hand is pressing, the other one is also pressing forward. So when it will work, you can do this one. Okay, you use the diaphragm or the bell?
Diaphragm.
Depende lang Actually, pwede din sa natin. But preferably, it is the bell. Kaya anong gamit ni bell? Anong gamit ni diaphragm? Kurala pag sure ang diaphragm. Anong gamit? Anong gamit ni bell? Anong gamit ni diaphragm? Okay, kaya pa. Mas okay. And bell parahan? Gupina sounds? Not necessarily. That is, the bell is used for low pitch sounds. Another diaphragm that is used for high pitch sounds. So ano natin mga low pitch sounds? Low pitch sounds is natin mga heart rates, natin mga bruits. You know what bruits are? You learn about that na lang. Okay, so like ang flow bahan natin and blood vessels, ganyan, abdominal sounds. Okay, so pas mo pa itong bell. Another diaphragm that's for high pitch sounds, which is your, let's say for example, another mga breath sounds. Okay, diba? Adi low pitch, mga low. Adi lang mga high pitch, diba mga diba? So mga wheezing, mga ralls, adi kita ito dito. Okay? What? So amon aton pag-check aton okay? So again, push, tapos na-push na din, Kaya kita na push para din mag-move ang fetus around. So push, dili. Or push, kung naka cephalic position in baby, adi kita dili makuha. So if the left side is smooth, adi lang kita push, sa adi dili, or adi. Okay? Then, we do the fundal height. Okay? So how do we do the fundal height? So you are going to check for the centimeters. Okay? Centimeters ito natin gagamiton. You are going to check for the zero. Okay? Kita mo yung kunahin ng zero part. Tapos amon di mo ibubutang diliton, pinakaubos. Tapos what you are going to do is, for me, ita akong binihimo, ibubutang ko dili between your thumb and your index finger. Okay? Depende ka ito iyo. If you're comfortable otherwise, then wala ito problema. So you're going to put zero, di natin ubos. Tapos you're going to slide this part until dito ito pundos. Kuha. Then you're going to check kung pera in centimeters. Okay? So once you determine kung pera ka centimeters, then makasabot kita kung pera ang each of the station. Okay, kuha. So, 4 grades, including the fetal heart tone and the, okay na. Thank you. Fetal heart tone and the fundal height. Okay, so again, fetal heart tone,